The following podcast is by Dr. Shawn Weiss, President of Senior Health and Wellness Group on the Answers for Elders Radio Network. And welcome back, everyone, to the Answers for Elders podcast network with Dr. Shawn Weiss from the Senior Health and Wellness Network. And we've been talking a lot this hour about, what it means to deal with situations, I guess would be better space of mobility, of situations of, environment, external factors of how we deal with staying healthy. But now we're going in a little bit deeper, and we're going to drive in a little bit more of the whole concept of home health. And, home health is different than home care. And we talked a little bit about what that difference is. But obviously, the thing that's really powerful about home health care is the fact that Medicare pays for it as long as you're under a care of a physician. Is that correct, Shawn?
Right. Well, and we get so many questions now because so many more people are needing home care services right now during the pandemic. So we get all kinds of questions. So it's a great opportunity on this podcast to educate and let people know, how do you become eligible for home care? So a couple things have to happen for Medicare to pay for your services, right? This is something that you're not going to have any cost out of your pocket if you're a Medicare recipient. I haven't billed a patient in 18 years. so if that tells you anything, but in order to do that, you have to, one, be under the care of a physician. Sometimes we run into a situation where grandma has moved back from Florida, is living with the daughter, and they haven't established care with a physician yet. So then we cannot go out as a skilled agency to see that individual until they have had a visit with a primary care physician. So you do have to have an established relationship with a physician in that area, not out of state. So important. And then when you do see the physician, they must certify that you need the following. And it has to be, they say intermittent, which is part-time. So you need intermittent or part-time nursing care. And the reason why they say part-time is because if you need full-time nursing care, then you need to be in a skilled nursing facility, which would be same as a nursing home. You need more care. So they need to certify that you need at least part-time or partial intermittent nursing care or therapy services, physical therapy, occupational therapy, or speech therapy services for either restorative care. And restorative care is a term which this is just typically what skilled home health does. Therapy comes out, you have declined or you've had a surgery, and we are getting you back to your prior level of function. So that's what we do. That's what we are experts in. But there's also another component to skilled home care, and that is the maintenance therapy side. And maintenance therapy and Medicare, they coined the terms several years ago, and allowing people, with really chronic conditions who really need our services to maintain their current level of function, whether it's the ability to get up and down out of surfaces and walk to around the home safely, or to get out of the home and go to the mailbox safely. Like those certain tasks, we may not expect a lot of improvement or new skills to be learned because of their chronic conditions. For instance, Parkinson's disease patients, chronic arthritis and pain, but certainly the ability to maintain the level that you're at for a safety reason is also considered part of the care. So either restorative or maintenance care therapy services, the physician will certify that you need those. And then the biggest thing that you hear about, you have to be homebound. And that is such a gray area because Medicare does a good job of not really making it very clear. But believe it or not, if you want to dig through the Medicare manual, they get kind of specific. And homebound doesn't mean you're bedbound. Homebound does not mean you cannot leave your home. Medicare clearly states in their services manual for eligibility that you can go out of your house a handful of times a week for any type of medical appointments, to attend church, to go to the beauty salon, all of therapeutic outings with the family. And as long as they're infrequent in nature, it's not like I'm going to go out every day and I can go walk to the park or drive down. Well, that's not going to work. You're not going to be eligible for skilled care services because you can get in the car and go down to the outpatient clinic, right?
Correct.
So Certainly, if you have any type of assistive device need for you to leave the home, to where you are unsafe and you need supervision to leave the home, then that's where we're looking at becoming eligible for services. There's a
Hmm.
safety need where you need to have assistance, and that needs to be, a considerable taxing effort. And of course, Medicare doesn't clearly define what that is. But if you've had a decline and you are not safe to leave the home without assistance, or somebody needs to drive you to where you need to go, then you're certainly eligible for home care. Doesn't mean you can't leave the home. You
Yeah.
just have to leave with somebody, right?
Right.
So
Right.
it's really important that people understand the
Mhm.
homebound
Well, it might be
requirement.
an example. I'm just going to throw something out there. What if
Mhm,
somebody breaks their arm or their ankle? They
mhm,
can't necessarily drive their
mhm.
car.
Right.
That would qualify,
Right,
correct?
because those are considered temporary homebound status. Yeah, you
Right.
might have just had a knee replacement and you're not allowed to
Sure.
drive, and your weight
Mhm.
bearing is different.
Yes.
Then you are temporarily homebound. So yes,
Right. But it
and there's
doesn't mean your family couldn't take you out to
absolutely,
lunch someplace or something like that.
absolutely,
Yeah.
absolutely,
So it's
yeah.
not that stringent as people specifically. Now,
Yeah.
when you
It,
talk about,
the burden of eligibility is always on the home care agency. That's the very first thing we look at when we come into the home, is making sure we are certifying this patient is
Mhm,
eligible and meets that criteria.
right.
And sometimes we have patients, let's say, like I said, I always go back to the Parkinson's disease patients because they are such great therapy candidates to keep their function and to keep their strength.
Sure.
And we do a lot of care with Parkinson's patients in the home. Um, but we might go in there and the patient clearly needs our services. We have a physician's order for the services, but my son or daughter just has not taken the keys away yet. And it's
Yeah,
just an extreme safety situation.
sure.
So that's when we are having heart to heart talks with, what, we're taking the keys away for this period of time.
Mhm.
Let's start small. That way you can get your services. You
Sure.
cannot be out driving. One, it's incredibly unsafe and dangerous, and you have no business doing it when you can't look over your shoulder. But
Mhm.
let's start preparing for what needs to happen
Absolutely.
down the road, which is,
Absolutely.
taking the keys away. So
Yeah. Yeah.
homebound, like I
And
said, there's
all of
lots
those
of things
things
we have to certify.
and all of those things, I'm sure that a primary care doctor understands
Mhm.
what the rules are. So when you're referred to home health, number one, you'll probably be a little bit educated by your doctor. And number two is really understanding what kind of services you're going to get. And I know that physical therapy and occupational therapy, people may not necessarily know specifically what they are, but do you want to just give us a real brief overview of what type of services, speech, different language,
Right.
different things like that?
Right. For whatever the physician feels is necessary, whether it's, let's say it's physical therapy, uh, there's straightforward, post-operative care. That's
Mhm.
certainly one. But you
Mhm.
might be having issues from a neurological standpoint, to where the doctor's
Sure.
like, want to come in the home for physical therapy. So what we do is, once we get the order, we are obligated by federal law actually to be out within 48 hours of an established referral.
Oh,
So
wow.
we're out there in the home doing a full comprehensive head to toe assessment.
Good for you.
Whether that's with a physical therapist or a nurse, we put a nurse out on every case to do that head to toe assessment. So we're looking at everything from skin integrity, full list of, we have to have all the medications out and looked at and verified. We're looking at how you access every area of your home. We're looking at shortness of breath, respiratory status. The list goes on and on. Any type of thing that you would get at your physician's office, we are doing a
Sure.
thorough, comprehensive assessment. Physical therapy is going to dig in a little deeper and do a very, as well as occupational therapy, do a very hands on assessment of your function. And that includes your joint mobility, your range of
Mhm.
motion, your strength. How are you transferring from surface to surface? Are you safe? We're going to do a fall risk assessment. We're going to look at your mobility through the home. Are you using an assisted device? If you don't, do you need an assisted device? And those recommendations. So we're looking at neurological screenings, we're looking at balance testing,
Mhm. Mhm.
all of the things. Occupational therapy is going to look at a lot of all the activities of daily living. Are you safely performing, and do you have the strength and the mobility to perform your activities of daily living? That is getting clothes out of the dressers and the closets and getting dressed by yourself. Are you able
Mhm.
to get in and out of the shower safely? Are you doing all of your grooming tasks?
Right.
safely, or do you need
Are
help
you
with that?
sitting down and standing up appropriately?
Absolutely.
Can you reach for certain items above your head if you've got shoulder issues,
Hmm.
all those things? I just
All
went
those
through
things.
occupational therapy on my
There you
hands, so
go.
I
See, there
know
you
all
go.
that story. Yeah, I
Yes.
had to go into a clinic.
Yeah. And we have speech therapy, that
Yeah.
goes in also, because we have
After
patients
stroke,
who,
that's
for
important.
stroke, there maybe have aspiration risk, and
Mm-hmm.
might need dietary straight changes in their
Yeah.
diet. Maybe they need to
Yeah.
go on a puree diet or something like that, where the patient doesn't have to leave the home to have that assessment done. We can bring the speech therapist
Mm-hmm.
in, educate the family, give them all the tools that they need for that.
Right.
And
Right.
like I said, skilled nursing, of course, for wound care,
Uh-huh.
medication teaching and management, chronic disease management,
Mm-hmm.
all of the above are just a wonderful set of services that uh,
Sure.
are there out there for our Medicare
Sure.
patients.
Sure.
And then
Well,
also something big too, if I have
yeah.
a second, do we have enough time? I hope.
Yeah. We have about a minute.
Medicare has changed some things during the pandemic that are still in place in terms of eligibility for home care services. They now allow nurse practitioners and physicians assistants to certify home care, which has been really, really helpful in terms of letting us
Wow.
access
That's
patients
interesting.
more. And then they have also lifted the homebound requirement during the pandemic. And what that means is maybe you weren't homebound, but now, because
Yeah.
of a
COVID.
quarantine or a high risk situation, maybe it's you have cancer or any other major diagnoses,
Autoimmune.
that allows you to have home health in without meeting the
Sure.
homebound requirement. So it's
Yeah.
really
Yeah.
important right now.
And that's important to note, because certainly, a lot of us gained weight. We're not as physically active as we were, during the
Mhm.
pandemic. We sat and binge watched TV shows and ate popcorn,
That's
and
right. I
so
know.
and the depression that sets in. And I think
Mhm.
that's the thing that, we look at. And certainly in our next segment, we're going to talk a little bit about cognition. We're going to talk a little bit about, what's really happened during the pandemic,
Mhm.
and how can you help your loved one through this transitionary period when things are kind of still up in the air still, but we're
Believe it or
getting
not.
through it. Right, folks?
Exactly. Exactly.
Okay, Shawn will be right back right after this. We would like to thank you for listening to this podcast by Dr. Shawn Weiss, CEO of Senior Health and Wellness Group, focusing on wellness and prevention strategies for seniors. As a fall prevention specialist, Dr. Weiss provides family support and education to keep your loved ones safe. You can learn more by visiting her website at www.seniorhealthandwellness.org.